Carolina Central University and has received her Master of Science degree in nursing from East Carolina University. She also holds a certification in the care of adult medical and surgical patients. She is a wife, mother, and born again child of the Most High King.
Good afternoon and welcome to Family Health Matters. I'm your host, Wendy Bridgers, and we are live in our studio today on Awesome Radio 106.9. And we're also on Facebook, Awesome Radio Facebook, and Awesome Radio YouTube. So thank you for joining us. And again, we are here every Thursday from 3 to 3:30 on Family Health Matters. So welcome. I'm so excited to be in the studio today, live with some really special people that has lots of wisdom and not a lot of knowledge that they're going to share with us on today. And everybody knows February is the National Heart Health Month, and we're continuing to talk about that for this month. And so our topic this today is Take Heart, Go Red. Go red. So take heart. And I have some special people. Again, like I said, I have with me Dr. Aundrea Oliver, yay, and Mrs. Valarie Gatlin Walker. And I was so privileged. I've known Valarie for many years. We go way back. And matter of fact, she was my manager and administrator when I worked at Biden. So Valarie, thank you so much for being here on today. Thank you.
Thank you, Wendy, for having me. And I am just so excited about Heart Month. It's one of my favorite topics. You know, this is my background in nursing, and I just appreciate you having me on Awesome Radio.
Well, thank you again. And Dr. Oliver, I know you're a busy woman, and I haven't had a chance to talk to you a lot, but I've met you for two times now. And then I got to see you on TV the other week, and you did such an awesome job. So I'm so excited for you to be here. So welcome to Family Health Matters.
Well, thank you, Wendy, for allowing me to be a part of your really important broadcast where you're reaching out to communities to educate and support and connect us all together. So this is a great opportunity for me to share with you ladies. Thanks for inviting me.
Well, thank you again for being here. So we're going to get ready to get started. But before we do, I want you all to share with the audience and me again with why Heart Health Month is so important. And tell me just a little bit about what you do. So Dr. Oliver, I know you work at Biden. So tell us what you do and what your specialty is, because I think it's just awesome. So I want you to, especially a Black woman in your role. So go for it.
So I'm actually a thoracic surgeon. And what that means is that I'm a surgeon who operates on the chest. I don't do heart surgery. So many people have had open heart surgery, and that's a separate, we're kind of divided into two camps. I do what we call general thoracic surgery. So I deal with everything except for the heart, including malignant and benign diseases that also include the esophagus and the first part of the stomach. So there's a lot of things I get to take care of. But a lot of the things that predispose people to having troubles that I get to take care of are the exact same risk factors that set people up for heart disease and stroke. And they're very close to my heart. So a great reason for us to have a conversation today.
All right. Thank you so much. Thank you. So here, I let you know we got experts at the table. So Valarie, I know you have always worn many hats, but the hat we want to focus on today is, I understand you're the vice chair of Transforming Christian Ministry Board and the director of Healthy Lives, Healthy Choices, which is one of the reasons why we have you sitting at this table on today. So tell us about that and tell us a little bit about what you're doing now.
Well, Transforming Christian Ministry is an organization that was started by the late Dr. Reverend Sidney Locks. And it is an organization that focuses on getting awareness and resources out there to community members that may not receive the information. Healthy Lives, Healthy Choices, I'm the director of, and it's my passion because I get to use my nursing skills and my health coach skills in working with individuals or church congregations to help keep their congregation healthy. And it's a passion for me to make sure that we as individuals learn how to take care of ourselves before we get sick, because the best cure is not to get the disease. So even though I'm a nurse, I'm always trying to prevent disease. And so Healthy Lives, Healthy Choices is an organization out there that have lay health advisors in the congregation to promote on the health of individuals.
Awesome. Awesome. That is great because I mean, it's all about the family. Family health matters. And the more information we can get out there to our families through the congregation, through communities, the better. And one of the projects I know that you've been doing all week, well, excuse me, all month is doing, I think it's just branches off of Take Heart, Go Red. It's where you've had different programs or events. So just, and with, and maybe if there was even any questions that was, occurred from that. So just tell us a little bit about, just a little bit about a couple of the programs that you've had.
Well, each church is governed at doing a program in their church any way they want. And most of the churches have really just been providing information about heart disease and how you can prevent it. But a lot of questions out there about dieting and exercise. I guess they hear this fact about dieting and exercise all the time, and they just wondering if this is really helpful. The silent blood pressure question has come up a lot.
Okay.
They're trying to understand how blood pressure is a silent killer.
All right. Okay.
So just some of the basic things that they hear every day, they just want to confirm that this is really being helpful.
Okay, great. And that's one of the reasons why we're here. So that we can bounce off of some of that. And also, even though people say that they hear it a lot, I think just being reminded over and over again is what hits home, is when you hear it again and something out of all the information that we share will click. And that's what we want to do. So let's jump into this. And so, Dr. Oliver, tell us a little bit about what is actually heart disease.
That's a great question. I think a lot of people hear things like heart attack or stroke, or they hear that somebody had a coronary and they don't really understand what that means.
Mm-hmm.
I really think that people should think about heart disease as not just disease of the heart muscle, but really what happens to our blood vessels. So you may hear the words cardiovascular disease. And that includes blood vessels that go to the brain that can give us, our strokes that we deal with from time to time. To understand what happens is that for all those blood vessels over time, there are factors that will change how the lining of those blood vessels behave. And so if we think when we're little kids, the lining of those blood vessels are nice and smooth, like a new slide at a playground. And as we get older, they get a little bit more lumpy and bumpy. They get a little bit of wear and tear. They might pick up a little bit of dirt and grass. And if they don't get cleaned out, either by healthy lifestyles or medicines that help keep that lining nice and pristine, it becomes a rough surface where normal healthy cells can build up, thinking that they're healing that lining, but instead they're making it smaller and narrower. What that means is that it affects the ability of those blood vessels to deliver blood and nutrients to the muscles and nerves that they're supposed to supply. And that's when people get things like peripheral neuropathy, so damage to the nerves, problems where they have muscle pains when they walk, which is called claudication because the blood vessels to the legs are clotted. Or if you have a blood vessel to the heart that gets blocked, that can give you a heart attack, or a blood vessel to the brain that gets blocked or narrowed can give you a stroke. The other types of strokes and other types of cardiovascular disease are when you have a blood clot, so something that happens all of a sudden in one of those blood vessels, and then it travels someplace where it gets lodged and it suddenly stops all blood flow to that organ. And that can happen with funny heart rhythms or other problems with diseases of the blood that make your blood too thick and set you up for blood clots. And those are a little bit beyond the scope of our conversation, but I really want us to think not just about preventing heart attack or just preventing stroke. And if we don't have those two things, we win, but really looking at your whole body as a system that works in harmony. And the things that we look to prevent and change are meant to make that machine work as well as that brand new slide in the playground. That's what we all want.
Absolutely. And that's not, too broad for a scope, because that helps you understand the whole process. So that helps you understand why why you have these aches, why you have these pains. So that was very good. That was very good. So now that you mentioned that all of these things can happen. So what if we're thinking about, and Valarie, you can jump in on this too, but when we're looking at things that we can do to prevent.
Well,
So
I would even, Valarie, maybe you can start with some of your experience with being a health coach and some of your work in the community of activities that you can maybe outline, and I can jump in on the other side.
So yes, I could probably take the whole show on this, but no, I don't have that. So some of the things that you can do, I want to touch on really just taking your medication. Most people think that blood pressure, I'm gonna get on this blood pressure thing. They think they can skip the blood pressure pills every now and then. But the key is blood pressure is something you can modify. They don't think they can modify it because it's considered they diagnosed with blood pressure, but you can if you exercise at least 150 minutes a week. If you eat the right foods, you can also get off those blood pressure pills, and your blood pressure pills can come down. Just because it's not working, something is not working for you, it doesn't mean you need to stop. You need to try something else. And you don't have to make the changes all at once. Make baby steps and celebrate those baby steps.
Oh, I like that.
If you don't walk at all right now, but if you get up and just walk 5 minutes a day, and then maybe the next day or the day after walk 10 minutes a day, that is helping your heart. But not doing anything is not helping your heart at all. So what I would say to everybody, do something, but not nothing, not at all. Just do something, one thing. And that's what I'm going to challenge everybody out there. After they hear this conversation today, pick one thing and just do it.
And I think that your idea of looking at it from the terms of baby steps, I think the biggest challenge for a lot of patients is feeling overwhelmed. When you go to the doctor's office, they come at you with all these different things. And I know a lot of patients feel frustrated by the number of medicines that they have to take. They're like, well, I have 3 medicines for my heart and I have 1 cholesterol pill, but I don't, so those are things that are very confusing in terms of the way that it's described to you. If you ever feel like you don't understand why you're taking something, rather than just stopping and seeing what happens, like what you're saying, Valarie, reach out to your provider. And if the provider's too busy, ask their nurse in the office. If the nurse is too busy to call you back, talk to your pharmacist. These are all resources that are available to us that some of us use, but maybe other people never thought about talking to the pharmacist.
Right.
They do have time for you, and they are fully trained to help you understand why some medicines have been prescribed for you. I think the other thing too is pick something that you can be excited about. So let's say you're not ready to change your diet. You really want to have some fat back in your greens. That's okay. But if you're going to do that, then try walking for 10 minutes a day. And once you get the walking as a habit, then let's talk about maybe some smoked turkey wings instead of fat back for, or salt pork for seasoning your greens. It's still going to be tasty. It's going to be different, but it's going to be better. And I think that and it does create a snowball effect. I think that once you feel better, you're going to crave different foods and more foods. And so you're going to find that you have a little bit more energy to do more things. And then you may feel a little bit more motivated to take on things that might feel more overwhelming. And the one thing that I wanted to kind of highlight for me is smoking. So, smoking something that, we're in the tobacco belt. This is where tobacco is grown well and has been grown for many generations. A lot of us are surrounded by it. We grew up with it. Many of us have been smokers ourselves in the past or current smokers. And I think taking away the shame of looking at smoking and seeing it as something that this is a health problem. Okay. So we're not talking about behaviors or anything else, but to be able to say, I want you to save your life. And that's why I want you to stop this. If you were going to drive a car that had no brakes and I was going to have you get on 264, you wouldn't do it if you knew that car had no brakes. But smoking is like driving with no brakes.
Oh,
and so I really feel like it's okay until you want to be able to come to a stoplight, and then you can't. And so I get to see patients who've been smoking for 30, 40, 50 years, and they think that there's nothing wrong because they're just having a cigarette in the morning with their coffee as they go to work. But I get to see them because they have a spot on their lungs, or they can't actually walk as far, and come to find out they've got blood vessel damage from the smoking. And furthermore, we can't operate as surgeons, whether we're heart surgeons, vascular surgeons, or myself as a lung surgeon and a chest surgeon. That smoking affects how you heal. So it's not even just about getting you off of it for just making it cheaper or making the house smell better. It's about trying to take care of you in an acute event and having you do better when we do want to fix some of the problems that arise from it.
That's wonderful. That's awesome. See, that's why we have you guys at the table, because this is straightforward, and it's to the point, and it's real. And I love what you guys said about the baby steps, because some people think that they have to have a big giant goal, and then you won't accomplish it if it's too big. But if you start small and add on and keep going. And one of the things that you were talking about was about the smoking. And I've heard people say, I've been smoking all my life. Why do I stop now? Now, my question to you, and I know the answer, but my question to you to share with the audience is, stopping smoking anytime is better than continuing, correct?
Yes. And this is actually, I get to have this conversation for most of my patient interactions. So there are several reasons why you want to stop smoking. So let's say you want to start exercising. If you stop smoking, you're going to be able to walk further. If you want to play with your grandkids, if you want to be able to go to the park with your kids, you're going to find that you're going to have a lot more energy. A lot of times people say, well, I don't want to gain weight. The smoking's kept me slender. Well, if you actually can breathe better, you can actually walk further and you can control your weight. The other reason why people find that they don't gain as much weight is because smoking also affects how people taste things, because it also affects how you smell. It affects your taste buds. And so food tastes better when you don't smoke. It takes 2 weeks after you smoke your last cigarette for the lining of your airways to finish healing from the damage that a single cigarette can do. That's the other thing. I tell people stopping smoking isn't like a diet. It's like being pregnant. Either you're smoking or you're not. So if it's one cigarette or if it's a whole pack, your body sees the damage from one cigarette and has to take 2 weeks to recover from that one cigarette. So stopping smoking, knowing that you're going to have that smoker's cough, but if you can make it through that 2 week window where you feel kind of nudgy, you're actually going to find that you're going to have a lot more stamina. You're going to sleep better. You're going to be a lot healthier. But also those effects build on each other. So you stop smoking, you help with your blood flow in all of your blood vessels. You can lower your blood pressure because the nicotine in smoke actually can cause your blood vessels to clamp down. It will help with both your heart function and your lung function. So although the damage that you may have done, so if you have COPD, we can't reverse it, but we can absolutely slow down the course of that and maybe prevent you from becoming oxygen dependent or prevent you from having that heart attack or stroke, so that the medicines that you've been prescribed for hypertension or cholesterol will have their chance to reverse some of the still reversible changes to your slide. And I'll let Valarie maybe take over with some other things that you've encountered with patients that, or community members that have had maybe some misconceptions.
Yes, misconceptions out there is that, the diet thing, it doesn't matter. Whatever you eat, they're always saying, well, if you eat this, they say it's going to give you cancer. If you eat that, this is going to cause that. What we want people to do is just live in the moment and try to do the right thing. And if you don't understand something, like Dr. Oliver said earlier, if you don't understand a certain diet, or if you don't understand a program or something you want to do to try to get healthy, you have resources out there. And I would say that's what our organization do. The director now over the chair of the organization is Reverend Barry K. Berryhill, and myself being vice chair. We are always welcome to go to any congregation to talk and speak and try to help you get the resources you need. We want you to feel that you're not alone out there. We want to help. We want you to live a long, healthy life. And that's what we are all about. So Healthy Lives, Healthy Choices is another option. If you don't want to talk to your doctor, you don't want to talk to your nurse practitioner, and you just want to talk to a lay person, just call us. We have a website, and you have lay health advisors in your churches. Just ask them, and we will definitely be there. But the idea of, eating, I'm gonna always say this because I just think it's the main thing to keep us healthy: exercising, eating right. And the other thing about eating right is moderation. I talk about I'm doing this fresh health food that comes to me, and I don't eat a lot myself, but the portion size that come in that box is really a handful. Your full meal is a handful, and at first I started saying this is not going to fill me up, but actually it does. So don't knock it before you try it, because it's like my husband cooked me a meal yesterday, and I was like, "Is this for both of us?" And he was like, "Yes, that's what was in the box," and it did. It actually filled me up when I didn't think it was. So try it. You might like it.
Yeah.
Well,
You have to be willing to sort of step out your comfort zone.
Yes.
And I would even say an easy way to do portion moderation is something very simple: is don't use a big dinner plate. Take a salad plate and then use that. And whatever you put on it, that's fine. And you don't need to fill it all the way to the edge. You can always get more. But what that does is it allows you to have a conversation. So if you have other people who are eating with you, if you have less food on your plate, you're more likely to talk and engage.
Absolutely.
Then it gives you a chance to actually feel full. Whereas if you have a big plate, you're trying to eat everything before it gets cold, and you're trying not to talk.
That's true.
And so make it easier. So your food stays hot, it stays tasty, but you also get a chance to talk yourself through enough so that your stomach gets a chance to get the message that it's eaten.
And I want to say something that I'm sorry to cut you off, but that's the other thing, the talk during dinner. How many times now, when I grew up, we all sat down at the table at the same time. We ate the same thing, and we had conversations. Nowadays, everybody's so busy rushing. We no longer sit down as a family. And so that's the message I also want to add out there. If you do it together as a family, not just one person in the family, have everybody try to change at the same time. Include your kids, because now kids are overweight, and it is a strain on their heart at an early age. So we need to include our children in these conversations as well. And we need to get our children moving some and get away from some screen time. So just make sure, and you most likely would be successful in your goal, whatever you want that goal to be, if you include the family in it, or include someone else. If you're alone, invite one of your friends. I'm one of these challenge people. I love for people to challenge me on my Apple Watch. I'm going to do everything I can to try to make sure I win that challenge. So it's about challenging each other, and include the family is a good way to help change your habits. And that's what I want to say. We need to look at changing our lifestyle habits.
That's good. That's very good. That's very good. Because it's all about the family. And that's what this show is always about. Family health matters because it matters. So those are some very, very good thoughts and things that you can just sort of, as old people would say, chew on. Okay, so we are moving on time, but I do want you just to take a few minutes and talk about risk factors. We talked a little bit about it. So talk a little bit about the modifiable and non-modifiable risk factors. And so just share that with us for just take a few minutes to do that.
And I'll be brief. When we talk about things that you can change and things that you can't, I think that's a simple way to think about it. Things that we can't change are who our parents are. So if we have a family history of heart disease or stroke, we may be at a higher risk because of how our body handles certain things we inherit from our families. We can't fix how we came into this world. If we're boys or girls, actually that the hormones that make us men or women actually change how our blood vessels behave and handle certain things that predispose us to heart disease. Women are actually protected while they're still menstruating more than men up until the age they go through menopause. And then our risk for heart disease rises to the same as men of the same age. So those are the only things that I would actually say are truly non-modifiable. Everything else, fortunately, we actually either have medicines that can help us change, or they're things that we can change ourselves. So the first thing, like we talked about, was smoking. The second is blood pressure control. And so sometimes that can be done with diet and exercise. Other times you need medicines to help you. The third is cholesterol. And a lot of people think, well, I don't eat much fat. Well, cholesterol comes in a lot of different things. And some of us, we don't get rid of our cholesterol as efficiently as others. And we need medicines in order to lower that. The great thing about a lot of those cholesterol pills, they have other health benefits. They reduce inflammation in a lot of other organs. And in some studies, they've even seen that it may actually slow dementia. And so that cholesterol pill might be doing a lot of heavy lifting for you, even though you don't feel any different. The same thing with the blood pressure medicine. You may not feel any different when you take it, but it's doing a lot of important work to make sure you never feel your blood pressure. And then lastly,
let me stop you. I know you're on a roll. I know you were trying to get it all in, but the cholesterol, and I know a lot of people say, if I take it every other day. So tell us a little about the importance of consistency as far as that's concerned, because you brought out a good point. It's not just about the cholesterol level, but the other things that's helpful that it does, because a lot of people don't realize that. So that was just a little bit, just really quickly.
So really quickly, it's just, if you have medication, your doctors have chosen certain medicines based on how they think they will work best for you. So you can't take your spouse's pills for a reason, but you also can't take them on your spouse's regimen or something that you heard from your girlfriend or someone at church. If you're prescribed to take it every day, unless you have side effects, you really need to take it every day, because it maintains a consistent level in your blood so that your body has that medicine to work with day in, day out, 24 hours a day, regardless of what you're eating or what you're doing, so that you have a very consistent profile that's protective against the things that medicine's designed to prevent.
Absolutely. So that is really good. And that goes the same hand in hand with your blood pressure medicine. Because some people say my blood pressure is down, so I'm going to stop taking my medicine, or that it made me feel bad. And men folks are really good about stopping the medicines. And I think, Valarie, you said something earlier about the silent killer, that we have people that's walking around that don't realize that they have elevated blood pressure. And then when they start symptoms, showing symptoms is really far down the road. So that is one of the things that we wanted to emphasize. So I know, Valarie, I know you got in your mind, you want to say something. Go ahead.
Yes, because you can have high blood pressure long before you even know you have high blood pressure. So that's why it's important to do all these other healthy things all during your life, so that, when you find out you have high blood pressure, it's not too far gone, and that it has already done other damages to your heart, your other organs in your body. So, yeah.
And I just would like to very quickly highlight one thing about hypertension, especially in young African Americans. So in our community, the biggest problem is actually aortic dissection. So
okay, you're going to have to come back, Dr. Oliver, to talk about that, because we are totally out of time.
Great.
But I just want to thank both of you, Valarie and Dr. Oliver, for taking time to come with us to be on Family Health Matters. Again, I'm your host, Wendy Bridgers, and we are here every Thursday on Awesome Radio 106.9 from 3 to 3:30. So again, thank you, Facebook family, for being there and listening, and we look forward to seeing you next week on Family Health Matters.
This is Awesome Radio.
Partial funding for this program is brought to you by